We're now looking at the interior of the knee joint. See the thigh bone on the top, the shin bone on the bottom, and the inner or medial meniscus cartilage. We're looking all the way out to the periphery on the top and lifting up and looking underneath. That looks fine back here at the back. So this horn of the medial meniscus looks fine. We're going to map the thigh bone, straighten the leg out all the way. That looks good. Flexing the knee back. That's nice and smooth. Just going to slip on back behind the knee and look posteriorly and laterally, immediately pushing up from behind. That looks good. Rotating the scope centrally and withdrawing. You see the posterior cruciate ligament here. Then coming on out here, which do you think? That looks like a very nice anterior cruciate ligament right there. So the next step is to look over into the lateral compartment of the knee joint where we anticipate finding the torn cartilage. And you can see this bucket handle tear of the lateral meniscus and how that's sliding into and out of the joint. So that's definitely been dislodged. And we can see the tear is right around in here. So in order to address that, I'm going to come in toward the front and push anterior edge bucket handle. You see how it goes on back around here. And then we use our motorized shaver to work on the anterior edge, and then we'll come back here and flank this from the side and remove it in detail. Okay, so you see the popliteal tendon. You can see the roughness on the tibial surface brought about by that torn meniscus. So now we're going to map the thigh bone, straighten the leg out all the way, and flex it back. That looks good. Now we're back behind the knee, looking posteriorly and laterally from behind. That's rotating centrally and withdrawing. We again see our main stabilizing knee ligaments. Next step is to look at the kneecap from above. So we're looking at the kneecap from above. That's this white structure here. We're going to look down into the lateral gutter. A little bit of scar tissue. That looks fine. Looking on up into the pouch. That looks fine. A little bit of scar tissue there. Back down the lateral gutter. See the tunnel for the popliteal tendon right here. And we've trimmed out the lateral meniscus. See the posterior horn of that right there. So we've got that cleared out. Looking over into the trochlear groove. Flexing the knee, a little bit of synovitis here. Some scar tissue which will clear out. A little roughness on the kneecap, on the trochlear groove there. A little synovitis over here. Now we're going to look up at the top, slide the shaver in through our portal of entry. Find some damage on the retropatellar surface right here. We're getting that smoothed down right there. You can see how that's nice and smooth. Coming on up here. Getting it cleared out. Now back up above the kneecap. And this concludes the arthroscopic surgical procedure.